Hi, everyone. Let's see. We're telling your followers that you have started a live video. I wanted to start a little bit early today because our guest is coming on at 11 o'clock our time, and he's super busy, but I just wanted to come on early to say good morning or good afternoon to all of you. It's Friday. Everybody made it to Friday, including us here at home together. We're still home together. My son Patrick and he's coming. I think he's making coffee. He wants to start a show called Coffee in Quarantine because he's such a coffee freak. But I know people always used to say TGIF, thank God it's Friday, because then they could go out on the weekend and have a whole different life. But now the weekend is somewhat like during the week, right? And we're just going to be still home together tomorrow and the next day and the next day. And so we're going to try to keep doing these videos one after the other to bring you joy, to bring you happiness, to bring you inspiration. And we're calling this Fact Friday because we want you to have facts going into the weekend about the most up-to-date facts that we can bring you, which is why we're bringing Dr. Sanjay Gupta to you today. So once again, I'm Maria Shriver.
I'm Patrick Schwarzenegger. I am Maria's son and co-host of this great show.
And my roommate.
And your roommate.
Yes,
and
we're roommates.
We've been having tons of fun being on here each and every day. I just got a text from someone this morning saying how much they enjoyed these talks and that they've actually implemented a lot of the lessons and values into their life. So, I love seeing messages like that and knowing that these are impacting people in a positive way and bringing optimism. And we're really excited to be able to talk with Sanjay Gupta, Dr. Sanjay Gupta, and
Yes.
get informed on a lot of what's going on right now in our country and around the world. So he's someone that's extremely educated in general, but on this specific topic of the coronavirus, and a longtime friend of yours.
Yes, that's right. And something that I read that he said recently, that he's been in journalism a long time. We've been friends a long time, and he's never seen a story move this quickly, change this rapidly. And so I think it's hard for all of us to stay up to date and make sure that we have facts that are real, facts that are usable, facts that we can use to educate ourselves and make ourselves safer and healthier. So that was the whole goal of bringing Sanjay on today. We shifted our time because he's super busy. He's on CNN kind of 24 hours a day. So this was the time that worked for him. So we wanted to shift to make sure that we brought him to you and that we fit into his schedule, because it's so complicated what he's doing and what he's trying to stay on top of, not just where it's blurry, very blurry. Oh my goodness.
I think I know a lot of people are saying it's blurry. From what we've been told is that Instagram has tons and tons of people on, and they're having a crazy amount of traffic, and that the Instagram lives have been disconnecting and have been blurry and everything. So we apologize for that. Nothing that we can really do, but
Yeah, we can just try to look our best. Just imagine us at our best. Imagine us clear. Imagine us in living color, and or maybe you could just listen with your ears, and you'll get the same information. But I don't know how we can view if Sanjay. I don't want to keep him waiting.
Yes,
there he is.
there.
So there's Sanjay. So waiting for Dr. Sanjay Gupta. We don't want to keep him waiting because he's like one of the busiest people on the planet right now. There he is.
Hey, it worked.
hey, how are you?
Guys, you guys look great. I was listening. You look perfectly clear on my phone, and you look
that's
wonderful.
good.
You look
Good to see you.
Where are you? You look like you have the beautiful woods behind you. Where are you?
I'm at home. I guess like most of America, I'm mostly been in my basement. So it's kind of a treat to be able to come upstairs and be outside and talk to you for a little bit.
Well, thank you, Sanjay, because I know how busy you are, and lots of people have given us questions to ask you, so we'll try to do it quickly so we don't take up too much of your time. But I'd like to start really with what people are hearing today about masks seem to be the new news is we should all be wearing masks if we go to the grocery store, if we take a walk, wherever we go. Is that correct?
That is not an official recommendation yet, but I can tell you, I think it's going to be. And let me just explain why for a second, because I know this has been really confusing for people. What we've learned over the past, couple of months is that this virus can spread even from somebody who is asymptomatic. And that means somebody who's not coughing or sneezing and, doesn't feel sick. And yet they can still have the virus in the back of their throat, in their nose, and can still spread it. So we're not talking about hospital grade masks, but even just cloth masks to wear in public, not necessarily to protect you from getting the virus, but to protect others from getting the virus from you, if that makes sense. I can tell you that, if you can see this or not, but my 11-year-old daughter made this mask for me. This is just a cloth mask. She sewed it upstairs. She heard me talking about masks, and everybody. I mean, it's amazing to me. Everybody wants to be helpful in some way. So, I found her sewing upstairs in our attic and sewing a mask. But I think that it's unusual. In the United States, we're used to seeing it, especially in other countries, especially like South Korea and China, people do wear masks often, and we're not used to it in this country. But I think there may be some real value, again, almost as an altruistic thing to help protect other people from you, because we all have to behave like we might have the virus.
So a lot of people here, and by the way, I'm Patrick Schwarzenegger. I'm
Yes.
so thank you so much for taking the time. I know we haven't formally met, but
Feel like I know you.
thank you. So I guess to furthermore on that topic is there's been a lack of supply for a lot of these masks. So a lot of people here are asking, are scarves okay? Are, you made one or your daughter made one for you at home? What is acceptable? And is this virus airborne, or is that what's protecting that?
Yeah, so that's a good question. Yeah, anything that really covers your mouth and nose, seems to be helpful. Some people are wearing those little neck warmers that people wear when they ski and just cover up their mouth and nose with it. Airborne is sort of an interesting descriptor, and I have admittedly been a little confused by this as well. I spoke to Dr. Anthony Fauci, who I think most people have heard his name by now, and I wanted to understand airborne to him and to a lot of infectious disease doctors typically means the virus gets out there and sort of suspends in the air by layering itself on dust particles. So if you've ever looked at like a sunbeam, and seen all the dust that's in the air, even when you don't realize it, certain viruses like measles, for example, will suspend themselves by attaching to those dust particles and can really just stay there for a long period of time. This virus doesn't appear to do that. Yes, it moves through the air, but it's moving mostly in respiratory droplets. Now, those droplets can hang in the air for a little bit, but they're typically heavier than dust. They're not going to sort of float upward. They're going to maybe hang in the air for a little bit, but then go to ground, go to surfaces, and that's usually how they get transmitted. If you're right next to somebody and they put out these the viral particles, you may get it that way, or by touching a surface and then touching your eyes, your nose, or your mouth. So it's not truly airborne in the strictest definition of the word, but it does travel through the air, just not like a measles virus does or something.
So Sanjay, are you saying that like we're living together, should we be wearing masks at home as well?
We don't in our household. I think when you're living together, you're obviously living together, and there's certain precautions that you may take, just keeping surfaces clean like that. We try not to have other visitors in the house, but I think unless somebody is truly becoming symptomatic, if someone starts to become symptomatic, which is still the biggest source of spread, I think it's okay. If someone does get sick, then quarantining yourself within your own house as much as possible, finding a bedroom where that person can stay, if possible, their own bathroom, which I realize is not easy for a lot of people, not sharing dishware, cutlery, things like that, and just keeping surfaces clean. But I think there is a real balance here, Maria, between what we can do and what is practical to do. If like my wife and 3 kids, we're all living together, we'll go for walks outside, and we'll be together when we walk outside. We're very careful about one of my many bosses. So I have so many bosses nowadays.
I know the feeling.
Yeah,
The most
right.
important boss
You
of
actually
them
know
all.
this boss. I won't say it on your feed, but
I know, I'm sure.
Well, I think that, speaking of living together, I've been living here with my mom, and one of the biggest things was it's extremely, dangerous for people that are, 60 or above, and not as much for people that are, 25 and below and stuff. But as we've seen now in the recent data, especially in America, so many people that are my age, I'm 26, have been actually taking up hospital beds and have been going out and getting infected. What is the research showing? Is that true that it's not that contagious or effective for young people, or is that not true?
no, I think that was sort of the story that initially came out of China, was that this is primarily affecting elderly people, and especially elderly people who have some sort of pre-existing condition. Heart disease was the biggest one. And I think it's true that people who are most at risk of getting critically ill and dying probably still fall into that range. I think it is still rare for younger people to die, although it happens. I'm just doing a story now about a 30-year-old baseball player, perfectly healthy,
Wow.
who died, and it's scary. It's really scary. I won't lie to you, but it is rare in those situations. I think your point, though, is a really important one, that even though if you just look at this in terms of living or dying, it may not paint the whole picture. About 20% of the people who are hospitalized in the country right now are between the ages of 20 and 44.
Wow.
So it is very clear that young people can get this. It's very clear that they can, get sick enough to be hospitalized from this. And another thing that I found really important was that sometimes there can be longer term impact. In China, they found that even young people, after they recovered and had no evidence of virus and said they felt totally fine, when they were examined, had about a 20 to 30% loss of lung function.
Wow.
So they may not notice it in their day to day, but ask them to suddenly run a mile, which they maybe could have done easily before, and suddenly they're much more winded and short of breath as a result. So, this is not a virus that you want. I think there's been this feeling that, hey, look, what's a big deal? I'm a young, healthy person. If I get it, no big deal. It is a big deal. I mean, you can get sick and you can have more permanent impact. You are less likely to get critically ill or die, but that's not always the whole story.
Sanjay, a lot of people, most of the country is under stay-at-home orders. Dr. Fauci is saying that he thinks the entire country should be under stay-at-home orders.
Yes.
We hear stories about people feeling fine one minute, the next minute they end up on the ventilator, and then they're dead. And then we see people with the virus anchoring evening news shows. So it seems to be kind of all over the map, and people are confused as to how serious this is, what is their role in staying home, and can you actually work with, and should you be working with the virus?
Well, I got to say, I think you're talking about Chris, and I've certainly advised him.
About it last night.
Yeah, and look, and I've advised him to not work and take care of himself. I think he's really trying to send a message to people, actually, that he, even as a young, healthy person, has gotten really sick from this. I mean, as you may have heard, when I say really sick, I mean high fever, 103, chills so bad. I mean, we've all had chills in our life, those bad shivers. Guys, I could tell you that his shivers were so bad that he chipped his teeth, from those shivers. So it's significant. I mean, I always try, as I know you guys do as well. I'm not trying to alarm people, but I think if they know that, you can get quite sick from this, I think Chris is going to recover and he's going to be okay in a few weeks time, but it can, be a serious disease. But you're right. There are some people who seem to have really minimal symptoms. We will probably find out a lot of people had this virus and didn't even know it. There may be people who are almost entirely without symptoms, and yet there are other people who develop a significant illness. what we're learning, and I think this is really interesting, is that for some people, it's the virus itself. The virus in somebody whose immune system is weakened, either because of age or because of some underlying illness. The virus itself replicates in their body more easily, affects other organs, and causes significant illness. For other people, for young people, for example, you're like, my immune system's fine. It could be that their body's reaction to the virus is actually what's causing the problem. Some people have called this a storm, a cytokine storm. But think of this like more like an anaphylaxis to a peanut allergy, right? It's like your body's doing the right thing. It's fighting off something that's foreign. But if the body overreacts to it, that can actually be the problem. And that may be what's happening to younger people, healthier people, in terms of making them critically ill. A totally different problem, right? So in someone who has a big immune response, you would give them steroids, which actually suppresses their immune system. You wouldn't want to give steroids to somebody who already has a suppressed immune system. And maybe a lot of detail, but it gives you some idea of what healthcare professionals are dealing with. Sometimes the totally opposite therapy for the same exact disease because of how the body's responding to it.
Wow, that's super interesting. And kind of speaking on that, a lot of people on here are commenting and asking, what are the best vitamins or best things to be taking to boost your immune system and to hopefully help combat something like this virus if they're working outside or having to be out in the field? I see a lot of zinc, extra vitamin C. Is there anything that you're taking right now?
I think that this is a really important point because I don't think we do enough to bolster our own immune system. I make sure, I think that you certainly don't want to be deficient in any of these things as a starting point. And a lot of people are probably vitamin D deficient, especially if we're asking people to be indoors. You may not be getting enough vitamin C. I don't think you need to hyperdose on these things, really for three reasons. One is that, hyperdosing can sometimes make you sick. I don't know if anybody who's watching has ever taken a lot of vitamin C. It can cause you to have significant stomach upset, diarrhea, and then you're thinking, well, is that the virus? Am I getting sick from coronavirus, or is that the vitamin C? Second of all, hopefully you guys have a good source where you're getting your supplements and your vitamins. But, it's an unregulated industry, so you got to make sure that you're getting clean, non-contaminated stuff. Right. And then, finally, you want to look at the evidence because you don't want to be lulled. I find it interesting that people get lulled into a sense of security. I'm fine. I'm, hyperdosed on whatever, and therefore I can go out. I can do things that I otherwise wouldn't do. So I think, boosting your immunity through good diet and good sleep and all that. I mean, I know that may sound silly in the midst of a pandemic, but it makes a big difference. And,
right.
I personally am trying to do that. I'm not practicing what I preach in terms of sleep right now, that's for sure. But I can't stress the importance of that enough. I think most human beings can probably do a pretty good job of fighting. Their body can fight this virus on their own, but we want to be best equipped to do so.
Right. And furthermore, I think something that I've really been interested in learning more about, I feel like every day there's such kind of negative news going out there. And recently I've seen some positive, but I'm not sure what to believe or know, was this kind of malaria drug. And they started to test it on a lot of different patients. And I read a New York Times article the other day where this elderly female came out and said that it saved her life and everything. But I feel like I'm not hearing that much about it. And so I'm a little confused. Has it been successful? Is there a lot of health risks using it, or why aren't we testing it more, or are we testing it a lot?
Yeah, no, I mean, there is a lot of enthusiasm around this for sure. I mean, I think it is being tested now, but the early early trials are still small because this is, we're all dealing with this sort of new and real time. New York has obtained, I think, 10,000 doses of this, and they're starting to use this in clinical trials. And, I mean, the small trials out of China, there was one that was just released yesterday, look encouraging. I mean, they gave 31 patients the medicine. They had another 31 patients who didn't get the medicine. They found that their symptoms were resolving more quickly, and they were less likely to progress from mild illness to more serious illness. But you've got to, you got to test it out. Well, and there can be some side effects, especially in people who have liver problems or kidney problems or a heart rhythm problem. But one thing I want to make sure is not lost in all this, though, is that most people will recover. right? Most people are going to recover from this. You know, the fatality rate, there's some sad stories, obviously, but you know, in China, it was somewhere between 1% and 2%. And in the United States, I think it's going to be around that as well. So when you say most people recover and then you're trying to test, does something make you recover better than something else? It becomes harder to really discern the benefit because most people would have recovered anyway. And I think that becomes the challenge a little bit. I'm optimistic that we're going to find a therapeutic, and I think that's going to be really significant. It's going to take, you know, longer, a year, 18 months, as you, I'm sure, heard. But if there's a good therapeutic for this, then I think that there's a real chance that if this comes back in the fall, which it may do, that we may be in much better position, you know, if we have a drug that works by then.
Sanjay, a couple people asked me to ask you, you know, what will our new normal look like when this is over, and when do you think it will be over? Are we looking at a future where we'll all be wearing masks all the time like they do in some countries? How long do you anticipate this going on for, and what will happen when we come out?
Yeah, I don't think this is a new normal. I think that I think there are a few things that are going to change, and I can tell you what I think those things are. But I think in terms of when this sort of ends, you know, I mean, we're going to see sort of what everyone's calling the apex or the peak of infections, I think, within this month of April. And then after that, even if the numbers of people who become infected still goes up for a while, the pace at which that's happening will come down. And I think that's what public health officials are really looking for. Like, do you start to see that the virus is just not spreading as quickly within you know, certain communities? And at some point, there may not be a total all clear flag that is being waved, but it'll become increasingly clear that it's not likely for people to become infected as they go out into the community. I do think there's going to be people who are going to be scared still, you know, to push an elevator button, to touch a door handle, to shake hands. But having said that, I do think that the idea that maybe something good in terms of how we actually think about hygiene overall will be a legacy from this. I mean, if you look back, even going back 100 years to Spanish flu time or to other, you know, significant pandemics from 50 years ago, for a period of time afterward, we are much more cautious, not paralyzed, but cautious, knowing that, you know, we humans can spread germs, you know, pretty easily to one another. So I think that will be a legacy of this. I also think, you know, and this is maybe not as relevant right now, but, you know, we weren't really prepared for this pandemic. And I'm not making a political statement here. Humans don't like to prepare for things that they don't see. I mean, we don't always eat the best diet or exercise because we don't see a heart attack coming, you know, and if you're 26 or 27 years old like you are, you know, you particularly don't think about that. I think about that stuff more after my dad had a heart attack, you know, whatever it might be, there's a switch that goes off. And I think this is going to be a little bit of a switch for people. Hospitals and the medical system aren't built to have a lot of redundancy or surge capacity because that's not a good financial model. Yet we do that with our Defense Department. We have a lot of capabilities there. And I think we're going to have to think about, you know, pathogens and pandemics the same way as well. I will say this, and I don't mean to sound at all Pollyannish, but you know, I think people have been really kind to each other. You know, I noticed that people are just, you know, I try and go out only when I have to, but when I do, you know, I noticed somebody wiping the handles as they were going through a door the other day, you know, just for the next person, obviously not for themselves. It was a public door. I see, you know, we get a lot of calls to the house. Can we help you? You know, my wife, when she goes grocery shopping, she's talking to people and getting groceries for other people. You know, my 11-year-old daughter made me a mask, you know, and I don't know. I think it's our default position as human beings to take care of one another. I think that's why we as a species have thrived and survived. I don't think it was ever about, you know, rugged individualism. I think it was always about reciprocal altruism. And when we are challenged like this, I think, you know, people rise to the occasion. So, I mean, again, I don't want to minimize what is going on, but I think that might be a really good legacy that comes out of this as well.
Right. And I just wanted to quickly understand, you said that this could come back in the fall, and I've seen a
Yes.
few people say, so is this actually seasonal? Does the warmer weather during the summer help prevent, or is this something that can just be always happening?
It looks like there may be a seasonal component to this. I mean, no one knows for sure. And, I always remind people that it's only been, really 3 months that we've been learning about this. So we're still learning more. But, in the first part of the outbreak, it was really pretty concentrated in the northern hemisphere of the world, where it was cooler. You did see cases here, but almost all of those were because of travel. As the weather has started to cool in the southern hemisphere, you have started to see more spread, which suggests that maybe there is a seasonal component to this. It's likely not to go away completely because of the season, but it might be easier to control. So that could be good news. But it also means, as you correctly point out, that as it gets cooler again, it may come back. But when it comes back, hopefully we're in a better position for testing, which we were clearly behind on. It might mean that we have this therapeutic, some sort of medication to treat symptoms and treat the disease itself, which would obviously be very welcome. So I think if it does come back, I think we'll be in better position.
Right.
I know, Sanjay, we're going to let you go because I know you have so much, but I read somewhere that you said, you've been in journalism and medicine for decades, but you've never covered a story moving this quickly, shifting this dramatically. How hard is it to keep up? And what should people know about the news that's coming at them?
Yeah, I really mean that. I think this is, I've covered conflicts, I've covered other pandemics, even this has been the fastest, most quickly evolving story I've ever covered. And I have to tell you that, I've been sort of covering this now since the end of December. And I mean, all in on this. I think about it all the time. I dream about it. And I'm not saying that in some sort of way that that makes me happy about it. I don't want to be dreaming about viruses, but my wife says that I mutter about it in my sleep. I have to read all the time. I'm talking to people all the time because, and I do it with a lot of humility. Marie, I think when you and I have had conversations about important topics in the past, brain health, heart health, whatever, I would say to you, look, based on 20 years worth of data or based on 30 years worth of data, here's what we're saying. Right now, we can't even say that we have that many weeks of data, as we have data on other things. So, and things change, so I have a lot of humility around this story, and I have to constantly say, like, with what we know now, what we know right at this moment, and, allow us to evolve with you, and let us learn together with this story. So it's totally different. And I mean, I hope, and I know we'll get through it. I know we'll get through it. Not I hope, I know. I don't know how long that tunnel is, but I'll be honest, I'm starting to see some glimmers of light already at the end of that tunnel. So hopefully we can talk again about that at the other end of that.
We're going to also come back at some point and talk about the book that you just wrote, that's so great about brain health and longevity. I don't know if it's still coming out in June, or I don't know what.
We're going to thank you for that. And, we're going to actually delay that book until January. It's a tough decision, and because it's also about brain resiliency. Yeah. And I think, when you're challenged with things, your brain can either be crushed by it or it can become stronger by it. And that was a big message in the book. And we're clearly being challenged now. But hopefully in January, Maria, I'd love to talk to you about it. That is my passion, as you know, the brain. And, but right now, this is the most important, not just health issue, but the most important issue of our time, the coronavirus. And, we're going to keep talking about it.
Well, thank you, Sanjay, and thank you to all the healthcare workers, doctors,
nurses,
everybody on the front lines. And you're on the front lines in this journalistic way, bringing us up to date. But a collective thank you to all those who stand behind you as medical professionals. We're all obviously deeply grateful.
Thank you so much. We really appreciate your time, and look forward to talking with you again in January.
You got it. Thanks for having me, guys. Good luck. Stay healthy.
Okay, thank you.
All right. Well, thank you guys so much for listening and watching. Hopefully we went through as many of the questions as we could. Dr. Sanjay Gupta was in a time crunch and had to get on.
He was on there for a long time.
Yeah, he was almost 30 minutes, but No,
really
I know,
long.
but it was we were blowing through those questions. You know,
Yeah.
we were trying to answer all the ones you guys were commenting about.
Whoa.
About what vitamins to take or what masks work or don't. And I hope that you guys learned a bunch from that because I was extremely interested in it.
What's your big takeaway?
Well, it was interesting because with other people we've talked with, it's usually kind of some sort of mindset takeaway or business takeaway. I think with his was just more about takeaways of actually learning about, the truths and the facts of coronavirus. And I found it really interesting to know that they are now testing that many people with the malaria drug, that this is something that is airborne, but not in the same sense as measles, I think he said, and other, but how important it is to wear, scarves or masks or anything that stops the saliva droplets from coming out, because that's the most, the easiest way that people can get infected.
I'm so glad so many people found it helpful, found him helpful, found the information helpful. Big takeaway for me is wear a mask, a homemade one. I'm going to take those bandanas that I have in the back of my closet out that I used to wear in high school and college that I kept around there. That's what they say. Everything comes around, including people my age. We come around. So does our clothes from college. So I have bandanas upstairs that I'm going to pull out and wear. But I think he was so well informed. I thought he was humble. I thought he was, so great in saying, like, this is moving so quickly that we're doing the best we can. I think he's been so on the front lines, Dr. Fauci, I think bringing us up to date. So it's important to keep ourselves up to date. There's somebody here saying, keep well, stay safe, keep informed. So I think that that's really the purpose of these conversations. As best we can, we're going to book people for you that will keep you informed, that will keep giving you information that will help you with your mindset. And tomorrow.
Yeah, tomorrow morning, 9:30 a.m. here in Los Angeles, we will be talking with Marcus Lemonis on my Instagram page, at Patrick Schwarzenegger. And Marcus is someone who is the face and runs the show called The Profit on CNBC.
Love it.
He's an investor in hundreds of small businesses, and he will be talking about kind of the economic times that we're going through, what specifically a bunch of his small businesses are doing to navigate through this kind of storm and shifting their business model. And he's a real entrepreneur and someone that really backs the ma and pa type brick and mortar stores. And he is a very educated person in this space. And I'm sure if you guys are fans of CNBC or watch the morning stocks and everything like that, he's always on there talking. So he's someone that I've looked up to, and I'm extremely excited to talk to him tomorrow.
We're going to call this something new. It's going to be called the Rookie and the Vet.
Rookie and the Vet.
That's right. So for the rookies that are out there, to learn from the vets, and then we're going to try to talk to small business owners about how they're adapting after he gives the advice. He's the vet.
Yes,
and,
exactly. And a lot of you guys are saying you're on the East Coast time. That's early. No. This is 9:30 here in Los Angeles. So East Coast, that's not early for you at all. You better not be.
12:30. You'll be at lunch.
Yeah, you better not be sleeping until that late. But yeah, I'll put it here on the comments, and I'll tell you where exactly you can find it. Pacific.
Yes, Femball saying, Patrick, you grew up to be an amazing young man. Yes, he did. He grew up to be an amazing young man. He's still growing up. And Corona Warriors, I like that. It says, we're Corona Warriors. No, Corona Warriors are out there working in our grocery stores, in our pharmacies, in our hospitals, home health care workers. I want to talk a little bit at some point about home health care workers who take care of loved ones with Alzheimer's and dementia and all other kinds of work. I want to, the Women's Alzheimer's Movement is going to be doing some things on that. But the Rookie and the Vet, it's premiering tomorrow. It kind of premiered with Ed Milet.
Last week we had Ed Milet, who a bunch of you guys loved, and we had so many views and messages about and how to shift your mindset and navigate through this business time. Even if you don't own a business, if you're not working at a business, it's great knowledge and info from people that are really experts in this space. So please come and watch tomorrow. And we look forward to seeing you guys and talking with you. And you have any questions, just DM me and continue to put in the little question spot. Today we had probably the most questions that we've ever had.
Oh, goodness.
So hopefully we got to as many as we could, and we will see you guys tomorrow.
Somebody just said there that my mom here, Liz, I just want to see this, Liz Selman, my mom is on hospice, dying at home, and we have an incredible caregiver who's sacrificing her time. Anyway, I'm sorry that you're having that experience, and I love that you just took a moment to shout out the person who's working in hospice and who's doing caregiving for your mom. I've done a lot of work with caregivers and the hospice movement, and there's an extraordinary group of people working in that space. So thank you for sharing that. I don't know why we're holding the phone down there.
Well, I was doing it so I could type.
They tell you never, if you're a woman, to hold the
Okay,
phone.
well then what do you want it up there?
I want it way, okay, all right. Okay, way,
All right,
just
guys.
at least even, the
All right,
light,
even.
the
All right,
light.
there you
I
go.
only eat in the dark.
All right, well, thank you guys so much. We will see you tomorrow, 9:30 a.m. Pacific, 12:30 Eastern, at Patrick Schwarzenegger on my Instagram. Talk to you guys tomorrow. It'll be on my Instagram for someone that Mama whatever that just asked. 9:30 Pacific, 12:30 Eastern, at Patrick Schwarzenegger, CHARZNEGGER. Boom. All right. See you guys tomorrow.
Share